Memory loss is one of the most feared experiences that begins to creep in quietly, especially after 65. It's not just forgetting names or misplacing keys, it's the panic of not being able to recall memories that once defined us. Mental health. Decline can be devastating for any senior. In the United States, millions of aging adults face this silent struggle, and yet so many remain unaware of the available tools that could delay or even reverse these cognitive issues. Food, nutrition, and supplementation play a critical role in mental stability, emotional resilience, and overall senior health. There is no single magic bullet, but there is real science behind certain nutrients that act as natural cures for brain fog, memory lapses, and emotional downturns, especially when combined with healthy habits and a mindful senior lifestyle. The first supplement to address is omega-3 fatty acids, especially DHA and EPA, which are essential for healthy brain function and have been studied extensively across the United States, United Kingdom, Canada, and Australia. Clinical research shows that seniors with higher blood levels of omega-3s have significantly less brain shrinkage and better memory retention. In the aging population, the brain starts to shrink by about 5% every decade after age 40. But healthy seniors who supplement with fish oil regularly, preferably a pharmaceutical-grade product, demonstrate better cognitive flexibility, sharper focus, and improved emotional control. Omega-3s work by reducing inflammation in brain tissue and improving cell membrane fluidity, which helps neurons communicate more effectively. Seniors who maintain omega-3-rich diets or add quality supplements can experience noticeable changes in mental clarity, which is critical for healthy living and optimal senior health. Vitamin B12 is the next cornerstone supplement for mental health and senior wisdom. Low levels of B12 can mimic dementia symptoms, things like confusion, memory loss, irritability, and even hallucinations. This is particularly alarming because many healthcare providers in the United States miss B12 deficiency in older adults, especially those who are still eating a standard diet. As we age, stomach acid declines, and with it, the ability to absorb B12 from food. Seniors over 65 should always check their B12 levels, and in many cases, high-dose supplementation is not just beneficial, but absolutely necessary. Intramuscular injections or sublingual tablets bypass the digestive issues entirely. The brain requires B12 for the synthesis of neurotransmitters like serotonin and dopamine, which influence mood, memory, and energy. Without it, even a healthy body and solid diet plan can't save mental function. That's why this vitamin should never be overlooked in any list of senior health tips. Another major player is vitamin D, often referred to as the sunshine vitamin. While most people think of it as a bone strengthener, its role in brain health is enormous. Over 60% of seniors in North America are deficient in vitamin D, especially during winter months. Numerous studies show a strong link between low vitamin D levels and higher rates of depression, memory issues, and even Alzheimer's disease. Vitamin D receptors exist in nearly every part of the brain, particularly areas associated with memory and emotion. Supplementing with 2,000 IU daily, sometimes more depending on blood work, is often essential for maintaining cognitive resilience. This is especially true for elderly populations in northern climates such as Canada and parts of the United States. A healthy senior needs adequate vitamin D, not just for bones, but for emotional stability, clear thinking, and even protection against brain cell death. Magnesium is another nutrient that plays a central role in memory and mental health. Awareness. This mineral is involved in over 300 enzymatic reactions, including those related to neurotransmitter function. For seniors, magnesium deficiency can lead to irritability, brain fog, anxiety, and sleep disturbances, all of which can accelerate memory loss. One particular form of magnesium, called magnesium l-theanine, has shown in clinical trials to cross the blood-brain barrier effectively and enhance learning ability and short-term memory. Seniors who supplement with the right kind of magnesium often report fewer mood swings, better sleep, and sharper thinking within weeks. For those practicing holistic health and seeking natural cures, magnesium becomes a non-negotiable part of the plan. Whether through food sources like pumpkin seeds and spinach, or through carefully selected supplements, magnesium supports healthy life outcomes for wise elders and those navigating life after 70. Probiotics are another surprising but powerful tool in the fight against mental decline. The gut-brain connection is real and backed by hard science. Over 90% of serotonin is produced in the gut, and an imbalanced microbiome can directly impact mood, focus, and memory. Healthy habits like consuming fermented food or taking a daily probiotic can have a profound impact on how seniors feel mentally and emotionally. Researchers in the United Kingdom and the United States have been exploring the effects of certain probiotic strains, like Lactobacillus, rhamnosus, and Bifidobacterium longum, on anxiety and cognitive performance. The results are compelling. Seniors who improved their gut health not only had fewer depressive symptoms, but also improved executive functioning. This is a crucial component of senior health that is still overlooked by many traditional healthcare systems. Healing the gut could mean healing the mind, especially in seniors who are struggling silently with brain fog or early cognitive decline. Ginkgo biloba, one of the oldest surviving tree species, has been used for centuries in natural medicine and is especially helpful in promoting mental sharpness and memory retention in the elderly. In recent years, ginkgo has become one of the most researched herbal supplements in the world, particularly in the United States and Germany. Clinical trials show that it improves blood circulation to the brain, supports mitochondrial health, and helps neurons resist stress. For seniors, this means improved attention span, better reaction times, and sharper long-term memory. It's particularly effective for those in the early stages of memory decline or experiencing symptoms of dementia. People across Australia and Canada are also turning to ginkgo as a trusted part of their senior lifestyle routines, and many elderly individuals report not just better mental clarity, but also a general sense of vitality. For natural healing and healthy aging, it's hard to beat ginkgo's track record. L-theanine, an amino acid found in green tea, is another supplement that supports both memory and emotional stability in seniors. It works by increasing alpha brainwave activity, which creates a state of relaxed alertness. L-theanine is particularly valuable for seniors who struggle with anxiety, restlessness, or insomnia, issues that are all too common but often ignored in conversations about senior health. When taken alongside caffeine or low-dose green tea extract, it can sharpen focus while also calming the mind, making it an ideal support for elderly wisdom and senior mental health. L-theanine supports GABA production, which is a neurotransmitter that counters stress hormones and promotes relaxation. Seniors who incorporate this into their daily supplement regime often feel calmer, sleep better, and are able to think more clearly during the day. Mental health awareness has to include solutions that go beyond pharmaceuticals and address the root of the imbalance. This is where l-theanine shines. Curcumin, the active compound in turmeric, deserves special attention for its ability to fight inflammation in the brain, which is a silent killer of cognitive health. Chronic low-grade inflammation is a leading contributor to depression, memory problems, and neurodegenerative disease in older adults. Curcumin crosses the blood-brain barrier and works as a powerful antioxidant, reducing oxidative stress that ages the brain prematurely. Clinical studies from universities in the United States and Australia have shown that seniors who supplemented with curcumin had better memory recall and reduced depressive symptoms compared to placebo groups. Many seniors incorporate turmeric into their diet, but the therapeutic effects often require a high-potency supplement that includes black pepper extract, piperine, for absorption. This is especially critical for seniors over 70 who are seeking home remedies to maintain a healthy mind and protect against the devastating effects of memory loss. Coenzyme Q10, CoQ10, is another powerful supplement for elderly individuals. As we age, the natural production of CoQ10 in the body decreases, which can lead to reduced energy production in brain cells and increased oxidative stress. In clinical trials, CoQ10 supplementation has been shown to improve mitochondrial function and delay cognitive decline in seniors. In the United States, it is increasingly being prescribed alongside statins because statin drugs lower CoQ10 levels, which can lead to fatigue and brain fog in the elderly. By supporting cellular energy production, CoQ10 not only helps the heart, but also protects the brain from the gradual decline many seniors experience in their 60s and beyond. Seniors who feel mentally drained, sluggish, or emotionally flat often notice improvements in vitality and sharpness after just a few weeks of CoQ10 supplementation. It's one of the best-kept secrets in senior health and should be considered a foundational part of any healthy body and healthy senior routine. Resveratrol, found in the skin of red grapes and in supplement form, is another powerful ally in the battle against cognitive aging. Its antioxidant and anti-inflammatory properties support healthy blood flow to the brain and reduce the accumulation of harmful plaques associated with Alzheimer's disease. Seniors who include resveratrol as part of their senior lifestyle may experience enhanced memory, better processing speed, and even improved verbal communication. Clinical studies from Canada and the United Kingdom suggest that resveratrol supplementation improves blood vessel function and supports healthier aging of the brain's vascular system. A healthy body requires consistent circulation, especially to the brain, and resveratrol is one of the few natural compounds shown to protect this function deep into life after 70. For healthy living and mental clarity, this supplement can play a vital role in daily routines. Lion's mane mushroom has emerged as a standout in the world of brain-supportive supplements, especially for seniors who want to enhance memory, rebuild nerve tissue, and slow cognitive decline. This unique mushroom contains compounds known as hericenones and erinacines, which stimulate the production of nerve growth factor, NGF, a protein essential for the maintenance and regeneration of neurons. In studies conducted across the United States and Japan, elderly participants who took lion's mane daily experienced improvements in memory recall, processing speed, and mood. This supplement is particularly popular among holistic health advocates and is often used alongside other cognitive-enhancing protocols. For wise elders seeking more than just pharmaceutical options, lion's mane delivers both healing and restoration at the cellular level. Seniors who struggle with naming familiar objects or who find conversations increasingly difficult often find measurable improvement when this mushroom becomes part of their daily nutrition strategy. Rhodiola rosea is another adaptogenic herb that enhances energy, stamina, and mental focus, especially in elderly individuals who feel mentally and physically drained. Its ability to reduce fatigue and improve concentration has been proven in numerous clinical studies, including several from research centers in Canada and Scandinavia. Seniors who deal with seasonal affective disorder or general apathy in colder months often report that rhodiola gives them a new lease on life. It works by modulating neurotransmitters like dopamine and serotonin, which not only stabilizes mood but also enhances mental performance. For those dealing with the fog of low motivation and emotional flatness, this herb offers a natural way to restore emotional vibrancy and mental clarity. For senior health, especially where energy levels and mental sharpness intersect, rhodiola rosea deserves serious attention. Bacopa monnieri, another herbal cognitive enhancer, has a long history of use in Ayurvedic medicine and is now well recognized in Western integrative health systems for its brain-boosting effects. It works primarily by enhancing synaptic communication and supporting the brain's natural antioxidant defenses. Seniors who supplement with Bacopa consistently over a few months often see improvements in memory acquisition, information retention, and learning speed. Studies in both the United Kingdom and the United States have validated its use for age-related memory decline. For elderly individuals who want to feel mentally sharper and more in control of their thought processes, Bacopa offers a proven solution. It pairs well with other brain-supportive nutrients like phosphatidylserine and l-theanine, creating a synergistic effect that supports a healthy mind and a healthy life. It's one of the safest and most effective ways to naturally boost mental health and cognitive function in seniors. Folate, also known as vitamin B9, is a crucial player in the methylation process, which affects mood regulation, detoxification, and gene expression. Low levels of folate in seniors are strongly associated with depression, poor memory, and increased risk of Alzheimer's disease. Unfortunately, synthetic folic acid added to processed foods can actually block the absorption of active folate in some individuals, particularly those with the MTHFR gene mutation, which is more common than many realize. Seniors across the United States are increasingly being screened for this genetic variation, and health-conscious elders are switching to active forms like methylfolate, 5-MTHF, to bypass this issue. Folate supports the production of neurotransmitters and helps regulate homocysteine, a toxic amino acid that can damage brain cells if left unchecked. Nutrition, not just medication, must be the foundation of senior health, and folate plays an indispensable role in that equation. Saffron extract might surprise many, but this vibrant spice has clinically validated antidepressant and cognitive-enhancing properties, especially in older adults. In clinical trials, saffron has performed as well as pharmaceutical antidepressants in improving mood without the typical side effects like sexual dysfunction or fatigue. For seniors, mental health awareness includes understanding that depression and anxiety are not simply normal parts of aging, but are symptoms that require serious attention and proper support. Saffron works by increasing levels of serotonin and dopamine, improving emotional balance, and helping to alleviate feelings of sadness or mental dullness. This is especially important for elderly individuals who live alone, have lost spouses, or are dealing with major life transitions. In the United States and Australia, saffron supplements are increasingly being recommended as a natural mood stabilizer for seniors, and many report feeling emotionally lighter and more mentally engaged within a matter of weeks. Huperzine A, extracted from Chinese club moss, is another supplement gaining attention for its effects on memory and cognitive function. It works by inhibiting the breakdown of acetylcholine, a neurotransmitter essential for learning and memory. Clinical studies, including those from Canada and China, have shown that Huperzine A significantly improves memory recall and attention in elderly populations with mild cognitive impairment. For those over 65, the brain's natural levels of acetylcholine decrease, which can severely affect memory retention and learning capacity. By slowing this decline, Huperzine A offers hope for seniors who are slipping into forgetfulness or struggling with names, appointments, or directions. It's often included in combination brain health supplements and has become a favorite among health professionals who focus on senior health tips and functional medicine. MCT oil, medium-chain triglycerides, derived from coconut oil, is another valuable tool in supporting brain energy. As we age, the brain's ability to metabolize glucose declines, which contributes to memory problems and cognitive fatigue. MCTs provide an alternative fuel, ketones, that bypass glucose pathways and feed the brain directly. This is especially useful for seniors experiencing early signs of Alzheimer's disease or those feeling mentally sluggish. Clinical research conducted in the United States shows that even a single dose of MCT oil can improve cognitive performance in individuals with mild memory issues. Healthy seniors are adding MCT oil to their morning coffee or smoothies as a way to boost brain energy, improve focus, and even assist in weight management. A healthy lifestyle that incorporates healthy fats like MCTs can dramatically shift how seniors feel on a daily basis. Choline, especially in the form of alpha-GPC or CDP choline, supports memory, learning, and overall cognitive function. It's a precursor to acetylcholine, one of the most crucial neurotransmitters for memory. Many seniors in the United States suffer from low choline intake, partly due to low-fat diets and poor dietary diversity. Without enough choline, the brain struggles to perform at its best, and symptoms like forgetfulness, low energy, and mood instability can appear. Supplementing with choline helps restore communication between neurons, supports the structure of brain cells, and enhances mental performance, especially in aging adults. Nutrition is a powerful tool in health awareness, and understanding how nutrients like choline affect the brain can change the trajectory of senior health outcomes. SAMe, S-adenosyl-methionine, is a natural compound found in every cell of the body and plays a critical role in mood regulation, neurotransmitter production, and brain detoxification. Clinical studies in the United States and Europe confirm that SAMe is as effective as traditional antidepressants in alleviating symptoms of depression, particularly in seniors. It supports the methylation process, helps clear toxins from the brain, and boosts serotonin and dopamine levels naturally. Seniors who experience low motivation, poor focus, or a general sense of emotional flatness often benefit immensely from SAMe. It pairs well with B vitamins and works rapidly to support mental health, often within a week of supplementation. For a natural, side-effect-free option to enhance mental well-being, SAMe is one of the most powerful compounds available. All of these supplements contribute in unique ways to preventing memory loss and protecting mental health after 65. They support the nutritional foundation of senior health, offering healing at the cellular level. Seniors deserve more than symptom management. They deserve tools that support healthy living, mental clarity, and emotional resilience throughout every decade of life.